What's Ace Medical, you may ask? Well, I'll tell you today. Just watch the video. So Ace Medical, talk a bit about it and then go into some in-game examples and footage. Basics of drugs, just for reference, Tmax is the amount of time it takes for max amount of effect from the drug, and T-half is the half-life of the drug. So just watch out for that for overdosing. TD50 and LD50, as long as you're not trying to overdose them, you should be fine. Usually they don't need that many doses. Now, our three most important, first one being ammonium carbonate stabilizes patients and wakes them up as long as they're below class 2 hemorrhage. We also have epi, which increases heart rate and BP, so it takes low cardiac arrest patients out of low cardiac arrest. And we have metoprolol, which takes high cardiac arrest patients out of high cardiac arrest. Moving on, basic states. Low cardiac arrest, typically, it says below 20 BPM, but it's typically 0. As well as BP, it's typically 0 milligrams of mercury overall. And then we get into higher cardiac arrest, it is usually above 220 BPM and above 284 systolic over 189 diastolic. In lower cardiac arrest, we do see a lower SpO2 level, but that's taken care of with what we'll talk about in the treatment. And then the SpO2 level for high cardiac arrest can just be anywhere, and it kind of depends. So treatment, you can remember the steps you take first through March, the acronym March, starting with massive hemorrhaging. So you need essentially bandages, tourniquets, and saline. And the types of bleeds we have are light, which is most common in our class 1 hemorrhages. We have medium, which is most common in class 2. And then we have heavy, which is most common in class 3 and 4. And we do see a lot of medium bleeds in class 3 hemorrhages as well. So generally when you have a light or medium bleed, you have outer extremity wounds, so nothing distal or medial. It's usually outer arms, not near the femoral arteries at all, not near the chest. But once you get into that medium heavy range where it's class 3 or 4 hemorrhage is where we have wounds to the femoral arteries into the chest. So femoral arteries are super important, they bleed out super quick, as well as the chest. Usually if you're shot in the chest and it registers as a heart hit, it'll either kill you immediately or give you a second chance, which is just a mechanic of the system, and that just causes you to go to immediate cardiac arrest and start bleeding out really quick from that wound. So if you're in heavy and class 3, you'll typically have one femoral artery wound, maybe a chest wound, maybe even 2. Class 4 hemorrhage is very common to have 2 femoral artery wounds and possibly a chest wound. And the way you operate is you start with tourniqueting these wounds, and then you move to the chest if you have to bandage that. Might take a few bandages, and then if there was a chest wound, you move back down here, get to working on these, bandage them up. And then once you have all bleeding under control, you pop a saline on and just get that hemorrhage all the way down to a class 1. And you kind of just monitor that as you go through next steps as well. And then you have your airway, you have your King LT and your O2 mask, which are super important. First checks you want to do is just clearing any vomit. Usually it happens with explosions. Then you check the respiratory rate. 0 respiratory rate, then you just, to be on the safer end, you insert the King LT, and you also add an O2 mask on top of that, and so that just makes it so if you've lost any SpO2, that kind of comes back up and you have a secured airway. And this kind of also helps once we get into cardiac arrest. So now the respiratory system is for R. Supplies, you just need chest seal and an NCD kit. Now, if you didn't see any of the pneumothorax indicators when you first were checking injuries for hemorrhages and bleeding, another way you can tell that you have some sort of pneumo is from the respiratory rate being above 14. And so that can either be either one of these. And so for the open pneumo, you have the prompt to put on chest seal, you do that. And for a tension pneumo, which you want to get on really quick, it can kill patients pretty quick, you use an NCD kit and just pop that in them. Moving on to cardiac, so cardiac arrest, all that good stuff. You need some epi, some metoprolol, and extra pair of hands is always great. For low-end cardiac arrest, it is pretty helpful to have an extra pair of hands. One person injects epi and the other hops on CPR, but you can do it yourself if you just inject epi and then hop on CPR. High-end cardiac arrest, you just inject metoprolol. You do not hop on CPR. That's not what you want. With low cardiac arrest, you see a pretty quick drop in SpO2. Now, SpO2 starts draining basically a health pool, and after 5 minutes the health pool gets completely drained and your patient dies. So you do have a decent amount of time, but you want to stay on top of it so the health pool stays as high as possible. Now, healing. This is just making sure all the vitals are stable, stabilizing it, getting it below a class 2, and then waking them up with ammonium carbonate. And then you tell them pop on a saline from their own to get their class 1 hemorrhage down to normal, and you can heal fractures if you have a med kit. Otherwise, you just pop a morphine in them and send them on their way. That's it, enough for the talking, and then we'll just get to some game footage. Alright, so this first clip, I see a guy on the ground, he's just been shot behind me. You can kind of hear their character groan, and I carry him off to obviously like a safer spot, because if you go down, you can't help them. So what I do first is I drop him, and what I like to do is then drag so they're facing up. Obviously check injuries first, and then I like to drag. And once you get them facing up, you just let go. You hit Control X for that. And then sometimes, as you'll see here, you can't really find where they're bleeding from. You pull out the bandage, and you're looking around, and nothing's showing up. None of the points or anything. But as you can see, super low bleeding, so he got up himself, which is pretty rare. Usually when they get knocked out, they need more than just a little bit. So looking around here, you find the bleed, kind of just put a bandage on it. Not super rushed, because he was low hemorrhage state and super low bleeding. So nothing too rushed. And then you kind of just start fixing bones. Is kind of just the slower part. I won't show this in the next clip, but I just want to show you guys. You just fix it up. Once you get the fix going, as you'll see, once he's done and all fixed up, you just give them a morphine shot, and that usually keeps them going for a solid amount of time. And they can just kind of run around and like not experience too much limping or slowing down. So yeah, that's the first one. Quick note before the second video, that radio menu that you saw popping up multiple times in the first clip, for PC the keybind is Control H, but I'm not sure for anything else like console. Alright, now the second one, I have a smoke in my hand because I just threw it so I could get to him safely. Carry him obviously nearest building. It does help, I have a second guy helping me here, and it will be pretty beneficial because of how serious this guy's injuries are. So I check his pulse just because it's the first thing showing up for me. See, it's 0. So then I really quickly want to get him flipped over. This other guy is working on his bleed. Thankfully this guy just had 1 bleed, so it's pretty easy. So then I check injuries, look for other bleeds. Nothing else. Check injuries. I missed the tension pneumo at first here, but I do see that he was in cardiac arrest. I told this guy to hop on CPR, so I give him epi, and when I check again is when I see the tension pneumo. And so I decompress him with the needle and then put a chest seal on. And as long as you can take care of the tension pneumo relatively quickly, if you're doing CPR, it should be just fine. Um, there usually isn't a big effect between the two. Like, you won't kill them if you start CPR and then really quickly fix the pneumo. So as you saw, he had a class 2 hemorrhage, just checking respiratory rate. Kind of got a bit in my head, got a bit ahead of myself here in terms of the cardiac arrest, but if you can get everything done super quick, it doesn't really affect the patient too much. At this point, I told this other guy I can take care of him. Uh, the down guy was now stable. I wasn't too worried, and so then I just start fixing up his fractures and all that stuff after just making sure one more time that his SpO2 and blood pressure is good. So I won't show you guys that since I already kind of explained that in the first clip. But yeah, you want to get it done just as quick as possible. Alright, that's going to do it for the video today. Hope you guys enjoyed. Any comments or questions, leave it in the comment section. There should be a defibrillation update coming at some point for ACE Medical, and I'll update the guide whenever that comes out. No clue when it'll be out, but I'll probably add another section into this and keep you guys updated. Thank you.